Hi there, I'm Dr. Candice Bovell, a registered clinical psychologist. If you are an adult living in Ontario and experiencing anxiety, stress, or depression, I'm here to help.
What is post-traumatic stress disorder? Post-traumatic stress disorder, or PTSD, is a serious, potentially crippling condition that can occur in people who've experienced or witnessed something traumatic, such as a natural disaster, serious accident, terrorist incident, sudden death of a loved one, war, violent personal assault, or other life-threatening events. Signs of PTSD may start soon after a traumatic event and then continue. Other people develop new or more severe signs months or even years later. PTSD can happen to anyone and can dramatically affect your life and the people around you. PTSD symptoms occur in 4 clusters. The first cluster is reliving the event, also called re-experiencing symptoms. These include nightmares, flashbacks, where you feel like you're going through the event again, or having emotional or physical reactions to triggers. A trigger occurs when you see, hear, feel, or smell something that causes you to relive the event. News reports, seeing an accident, or hearing a car backfire are examples of triggers. The second symptom cluster involves avoiding situations that remind you of the event. For example, you may avoid crowds because they feel dangerous. You may avoid driving if you were in a car accident or if your military convoy was bombed. If you were in an earthquake, you may avoid watching movies about earthquakes. You may keep very busy or avoid seeking help because it keeps you from having to think or talk about the event. The third cluster involves negative changes in beliefs and feelings. You might not have positive or loving feelings towards other people and may stay away from relationships. You might forget about parts of the traumatic event or not be able to talk about them. You might think the world is a completely dangerous and awful place and that no one can be trusted. The final symptom cluster involves hyperarousal, a feeling of being keyed up or on edge. You may have a hard time sleeping, you may have trouble concentrating, you might be startled by a loud noise or surprise, or you might want to have your back to a wall in a restaurant or waiting room. Many people have benefited from the well-researched treatments for PTSD. Treatment is available from Wellness View Psychological Services, Ontario. Treatments for PTSD and trauma include prolonged exposure. That involves retelling your trauma story during sessions, listening to your trauma story at home, and gradually exposing yourself to situations you avoid, and cognitive processing therapy, CPT, that involves writing your trauma story, reading your trauma story at home, and challenging or changing your extreme beliefs related to your trauma. Cognitive behavior therapy, or CBT, is included because it teaches you how to challenge or change problematic thought patterns and unhelpful behaviors that contribute to symptoms. Mindfulness-based cognitive therapy may also be included because it teaches you how to be in the present moment on purpose in a non-judgmental way. Also, relaxation training and behavioral activation can help. They include regularly practicing breathing exercises, relaxation exercises, and engaging in activities that are relaxing, enjoyable, or useful. A minimum of 8 to 15 therapy sessions is recommended.
If you would like to book an appointment, please visit www.wellnessview.ca and complete the confidential screener.
Thanks for watching. Please like and subscribe.